Right. Hello, my name is Brittany Brito. I am a pharmacy resident with the University of Utah, and I will be presenting on a new horizon, recently approved medications that may be beneficial in migraine management. So what I have done is I looked through the medication approvals from the last year, 2023, from the FDA for migraine-specific medications and possible migraine medications to see if there were any that were recently approved that could possibly be used for migraine management. For acute treatment, there was one medication that was approved that we'll be discussing. And for preventative treatment, there were no medications approved, but there is one that's in development that we'll be discussing. As far as possible migraine medications, there are several categories that we use for preventing migraines, such as antidepressants, blood pressure medications, anti-seizure medications, and nerve pain medications. The only category of preventative migraine medications where we saw some approvals of drugs that may be useful were in the antidepressant category. So I'll be going over two medications that may be used in the future. Our first medication that we'll be discussing today is specific to migraine and more specifically for acute treatment of migraine, and that is zavegepant or Zavspret. This medication is approved for moderate to severe acute treatment of migraines. It comes as a nasal spray, and how you administer is you give one spray into one nostril as a single dose. With some of our other acute migraine treatments, so treatments that are given at the sign of a migraine attack, we can give repeat doses if our first dose isn't effective. That is not the case with this medication. It's only been studied with one dose. It should also be given at the first sign of pain to improve the response to treatment, similar to our other medications. And how it works is it's in a category of medications called CGRP antagonists. So it blocks a protein called CGRP from binding to its receptor in the brain. And in migraine attacks, CGRP is a molecule that ramps up pain signaling and inflammation. So blocking that molecule from binding to its target can help with pain relief and reduction of other migraine symptoms. This medication may be best suited for patients that cannot take triptans like sumatriptan or rizatriptan. So these patients would be those that have heart disease, a history of a heart attack, or other cardiovascular conditions. Patients who haven't responded previously to other triptans or acute treatment options, or patients who have had bad side effects to our traditional triptan treatment options. On this slide, I have some pictures that outline how the dose of Zavspret is administered. So first, the patient will need to blow their nose to get rid of any excess mucus, and then you will remove the nasal spray from its packaging. You'll take the nasal spray device, which is preloaded with a single dose, and push the device firmly up one nostril and hold the other nostril shut. Press the plunger up from the bottom and breathe in through the nose. After administering the dose, you'll keep your head level and upright. Breathe in and breathe out normally for 10 to 20 seconds. Some other useful tips for administration of this medication is that the head needs to be upright and level for the whole administration process. So it's best not to tilt your head and not to lay down while you're delivering the dose. If you do feel a drip come down from your nose after you give the nasal spray, it's okay to gently sniff it in so that you don't lose any of your dose. With zavegepant, there are some possible side effects, the most notable being altered taste, and that was noticed in about 20% of patients in clinical trials, along with some mild nasal discomfort or some nausea and vomiting. But the nausea and vomiting could have also been a symptom of migraine attack in general. With this medication, while it is administered nasally, there are some other drug interactions that we need to keep in mind. The most important one would be nasal decongestants like Afrin or Sinex, because they can decrease the absorption and effectiveness of our nasal spray that we're using to treat the migraine. There is also some interactions between inhibitors and inducers of the enzyme that breaks down the medication, so we want to avoid combining those if possible. Inhibitors of this enzyme would include some antibiotics or HIV medications. So if we inhibit the enzyme that breaks down the medication, that could increase our risk of side effects. And if we combine it with medications that induce or ramp up the metabolism of our zavegepant, that could make it less effective for treatment of migraine. And this would include anti-seizure medications like carbamazepine or anti-inflammatory medications like Rinvoq or abatacitinib. Next, we'll move on to medications that may be used in migraine prevention. So as I mentioned in the beginning of the presentation, we'll talk about two antidepressant medications that have been recently approved. The first one is called Gepirone or Exua, and it was approved in September of 2023. It's not widely available yet, and it may be very expensive compared to other options because it's going to be brand name only for a while. How it's administered is as an oral tablet. We give an initial dose of 18.2 milligrams once per day and gradually increase the dose every few days until a target dose of 72.6 milligrams is reached, as long as you're responding well and are not having any troubling side effects. This medication is best taken with food and should always be taken at the same time every single day. Something to note with this tablet is that it can't be crushed, cut, or chewed. So for people that have difficulty swallowing tablets or can't swallow tablets, this might not be the best option to use in the future to prevent migraine. In addition, this medication hasn't been very well studied in patients with chronic kidney or liver disease, or dosage adjustments may be required in cases of mild chronic or kidney or liver disease. If patients have electrolyte imbalances with sodium, potassium, calcium, or magnesium, or they have what's called a prolonged QT interval, which can be measured with a heart monitoring ECG or electrocardiogram, this also may not be the best medication. If patients do have that prolonged QT interval or electrolyte imbalances and they take this medication, it can increase risk of dangerous heart arrhythmias. I wanted to point out some differences between how Gepirone works and how our other antidepressants work that we typically use in migraine prevention. So how Gepirone works is it increases the activity of serotonin in the central nervous system through activation of serotonin receptors. Low serotonin has been linked to patients being more susceptible to developing migraine headaches. So targeting serotonin and increasing it can actually be beneficial for controlling migraine attacks. We also have other categories of medications, such as our SSRIs, or selective serotonin reuptake inhibitors, which would include medications like Lexapro or Prozac. And those medications, along with our SNRIs, our serotonin norepinephrine reuptake inhibitors like duloxetine and venlafaxine, increase the activity of serotonin by blocking reuptake and degradation of serotonin into brain cells. Finally, we have our tricyclic antidepressants, or TCAs, like amitriptyline or nortriptyline, that are used for migraine prevention. They also block reuptake of serotonin and norepinephrine, but do so in a more nonspecific manner and can cause some more side effects. Some other things to note about Gepirone or Exua are that it can cause some nausea, dizziness, drowsiness, fatigue, and on the other hand, some difficulty sleeping. And like other tablets that can be taken, Since it is being exposed to your body, there are other interactions with other medications that are taken orally. Most notably, this medication increases serotonin, so ideally we shouldn't combine it with other medications that also increase serotonin, because that can cause some dangerous side effects. In addition, it should not be combined with medications that prolong the QT interval that I talked about before. So this may include some antibiotics, some anti-nausea medications, some antiarrhythmic medications, but whenever you start a new medication, if you are at risk of having a prolonged QT interval, your doctor may do an electrocardiogram test to see how at risk you are and check your electrolytes. This medication is also broken down by an enzyme called CYP3A4, which is responsible for a lot of metabolism of several medications. So again, if we combine it with medications that induce the activity of CYP3A4, that would make the gepirone less effective. And this includes medications like carbamazepine, phenytoin, and modafinil. Whereas if we combine it with inhibitors of the enzyme, that could make side effects more likely as the concentration of gepirone could increase in the body. Inhibitors would include medications like Paxlovid, antifungals such as fluconazole, other antibiotics, calcium channel blockers that are used for blood pressure lowering like verapamil and diltiazem, and grapefruit juice. The other medication that was recently approved for depression was called Zuranolone or Zurzuvae. And this is specifically approved for postpartum depression, so depression that occurs in women after they give birth due to an imbalance in hormones. This medication is also an oral medication. It comes in a capsule. It's delivered as a 50 milligram dose once daily for 14 days, and you can reduce that dose based on side effects. This medication also has some specific instructions for how it should be taken. It should be taken in the evening and with food, specifically a fat-containing meal that's pretty substantial, between 400 and 1,000 calories, containing 25 to 50% fat. And that's so that the medication can be absorbed adequately. If the medication is not absorbed, it can't work. This medication is best suited for women because that's the population that it was studied for, particularly women who have recently given birth. The studies also noted that they wanted this medication to be used in women who were able to use contraception during therapy and for at least 1 week after the last dose. Similar to gepirone, this medication is not best for patients with chronic kidney and liver disease, as the medication can accumulate and cause more side effects in these patients, along with patients who are concerned over drowsiness or decreased energy and focus levels, as those are the main side effects of the medication. This medication was also not studied in pregnant patients. Possible side effects, as I mentioned previously, the main ones to look out for are dizziness and drowsiness, but there was also some diarrhea noted by patients who have tried this medication out. Interactions with other medications to keep in mind include combination with other medications that can cause dizziness and drowsiness. So this would include sleep medications, narcotic and opioid pain medications, gabapentin and Lyrica, muscle relaxants, and Benadryl, along with others. We should also avoid medications that inhibit or induce CYP3A4, as was mentioned with the gepirone. So those same inducers and inhibitors could affect the way that the medication works or cause it to build up to toxic levels and cause more side effects. Lastly, I wanted to spend some time talking about a new investigational medication that's being studied for migraine. And this medication has not been named with a fancy name yet. It just has a research name, so that's why it looks kind of funny on the screen. But it's being studied for preventative treatment of migraine, and it hasn't been approved quite yet. How it works is it's an antibody that blocks signals by PACAP, and that is a protein in the brain that's thought to contribute to migraine attack. And this would be a new treatment pathway that hasn't been targeted by other medications. Right now, we have some other antibodies that have been approved that are targeting CGRP, and that would be our medications like Emgality or Aimovig. So there are some trials that are ongoing with this medication, but one that is in the works right now has been published on clinicaltrials.gov with some preliminary data. So I just compiled that so that we could discuss it here. With this trial, about 90% of patients were female. Most patients were around 40 years old, and most patients had about 17 migraine days per month prior to the start of therapy. And I wanted to point out the details of the patients because that could indicate who this medication has the best evidence for. As we can see, with the 90% of patients being female, we may not know if this medication works effectively in males as much as we do for females. Other than that, though, the demographics of patients that were included in this trial or the baseline characteristics of what other conditions that they have or whatnot seems pretty consistent with what we see in our normal migraine patient population. Based on some preliminary results, after patients got 2 doses of the medication, which is given as an IV infusion, patients who received the active treatment received those 2 doses and reported 6 fewer migraine days versus patients on placebo who had 4 fewer migraine days per month. The side effects to this medication included increased respiratory infections and increased fatigue. One thing to point out with these results is that this trial is still ongoing, so we don't have the final numbers of patients who had a response to therapy or side effects yet. So we still need some further studies in a larger number of patients before the medication can be approved by the FDA. In addition, we don't know how insurances would cover this medication, given that it is an IV infusion, and we also don't know the ideal dose or dosing schedule, so we don't know how many milligrams we need or how often it would need to be given. And that concludes our talk today. Thank you so much.